Gentlemen, I know that there are intimate health issues you often feel hesitant to share, yet quietly search for solutions. And to help you regain your performance and confidence, today I will introduce you to 3 methods that have been researched and proven to enhance men's sexual health and performance. I'm Dr. Marie, and I have accompanied countless gentlemen on their journey of caring for their sexual health over many years. In today's journey, I will explore with you ways to boost blood circulation, maintain strength, and prevent the decline of function, all of which are safe, simple, and completely doable at home. Especially, did you know that the mechanism of an erection does not rely solely on emotions or hormones, but largely depends on the health of your vascular system? And in the very first part of this video, I will reveal a natural, little-known secret that can help you see significant improvement after just a few weeks of training. Don't miss it. Before we begin, I'd like to know where you are on the world map as you watch this video. Leave a comment below. I'll be very happy to know who I'm sharing this journey with. And if this is your first time visiting the channel, don't forget to hit subscribe and turn on the notification bell so you won't miss useful health tips for men. Now, let's step into the very first method, and trust me, you won't want to miss this. Method 1, strengthening the pelvic floor with Kegel exercises. When it comes to improving erectile function, most men immediately think of medication or dietary supplements. Pills, herbal teas, or performance boosters often seem like the quick fix. But the truth is, there's a group of hidden muscles that determines whether blood can stay locked inside the penis during arousal. These are the pelvic floor muscles, located right at the base of your pelvis, forming a supportive hammock that holds up the bladder, rectum, and most importantly, controls erection and ejaculation. Why the pelvic floor matters. Think of these muscles as the foundation of male sexual performance. If they are weak, several problems arise at once. Difficulty maintaining a strong erection because blood leaks out of the penis too quickly. Reduced control over ejaculation, leading to premature release. Even urinary leakage or dribbling after urination. Research from the University of Exeter and the University of Bristol has shown that men with erectile dysfunction who practiced pelvic floor training for just 3 months experienced significant improvements in erection hardness and ejaculatory control without medication. How to identify the right muscles. Many men mistakenly tense their abdominal or buttock muscles, but the pelvic floor is deeper. The easiest way to locate it is this. During urination, try to stop or slow the stream midway. The exact muscles that activate are your pelvic floor muscles. Once you can isolate this feeling, you'll be able to practice anywhere while sitting at your desk, standing in line at the supermarket, or lying in bed before sleep. Step-by-step training routine. Start small and gradually increase. Slow contractions. Tighten the pelvic floor muscles, hold for 5 seconds, then relax for 5 seconds. Repeat 10 times. Fast pulses. Contract quickly and release 10-15 times in a row. This trains explosive strength for ejaculation control. Endurance hold. Once stronger, hold each contraction for 10 seconds, aiming for 5 repetitions. Perform 2-3 sets per day. Consistency is more important than intensity. Think of it like brushing your teeth, a simple habit that pays off long-term. Benefits you can expect. With 6-8 weeks of regular practice, many men notice stronger erections due to improved blood retention, better orgasm quality because of increased muscular control and sensitivity, reduced urinary issues, especially post-urination dribbling, and perhaps most importantly, greater self-confidence both in and out of the bedroom. Pro tips for faster results. Combine with breathing. Inhale deeply as you relax, exhale as you contract. This engages your core and enhances muscle activation. Don't overtrain. Just like any other muscle, the pelvic floor can fatigue. If you feel soreness or pain, rest for a day. Stay patient. Visible changes often come after 6 weeks, but subtle improvements in sensitivity and control may be felt sooner. My friend, if you're still watching this video up to this point, it means you truly care about taking control of your health. Type the number 1 in the comments below so I know you're still here with me. And stay tuned, because the next method I'm about to share will directly enhance blood flow into the erectile tissue itself. helping you achieve maximum firmness faster than you might imagine. Method 2, using a vacuum pump to support blood circulation. Alongside pelvic floor training, another powerful yet non-invasive method to restore erectile function is vacuum erection therapy. This approach has been used for decades in urology and rehabilitation clinics, and it remains one of the safest ways to improve penile blood flow without relying solely on medication. Why vacuum therapy works? An erection is simply the result of blood being trapped inside the spongy erectile tissue, the corpora cavernosa. If the blood flow is weak, or if it escapes too quickly, achieving and sustaining firmness becomes difficult. A vacuum pump helps solve this by creating negative pressure around the penis. This pressure literally pulls oxygen-rich blood into the erectile tissue, filling it up much like air inflates a balloon. For men recovering from prostate surgery or dealing with long-term erectile dysfunction, this method has another important benefit. It prevents the penis from shrinking due to lack of use. By stimulating regular engorgement with blood, vacuum therapy helps preserve tissue elasticity and prevents scar formation inside the erectile chambers. How it works step by step. The device, a vacuum erection device, VED, consists of a clear cylinder tube that fits over the penis, plus either a manual hand pump or an automatic battery-operated pump to create suction. Creating suction. Once the tube is in place, negative pressure gently draws blood into the penis, resulting in a natural erection. Maintaining the erection. After firmness is achieved, a soft constriction ring can be slipped onto the base of the penis. This ring prevents blood from flowing back out, allowing intercourse to take place. Duration. Each session typically lasts 10-15 minutes. While some men use it daily for rehabilitation, most find that 2-3 sessions per week are enough to see noticeable improvements. Manual vs. automatic pumps. Manual pumps, affordable, portable, and effective, but require hand strength and practice. Automatic pumps, easier to use, especially for older men with arthritis or reduced hand mobility, though they tend to be more expensive. Regardless of the type, proper training from a doctor or specialist is crucial. Incorrect use can cause bruising, numbness, or discomfort, issues that are easily avoided with correct technique. Benefits beyond erections. Vacuum therapy doesn't just help with achieving temporary firmness. When used consistently and correctly, it can improve penile oxygenation, which helps maintain healthy tissue. Increase confidence for men hesitant to rely only on pills. Serve as a rehab tool after surgery, keeping the erectile tissue flexible and responsive. Combine with medication. Studies show that using a vacuum device alongside PDE5 inhibitors, like Viagra or Cialis, often boosts results, particularly in men with more severe dysfunction. Safety and practical tips. Never keep the constriction ring on for longer than 30 minutes to avoid circulation problems. Always use a water-based lubricant to ensure a proper seal and reduce skin irritation. Choose a pump that is FDA approved or recommended by your urologist, as cheap imitations may lack safety features. So, while the first method, Kedgels, focuses on strengthening muscles that control erections, this second method provides a mechanical boost, ensuring that blood actually reaches and stays inside the erectile chambers. And we're only getting started, because the next method we'll explore doesn't just target muscles or immediate blood flow. It goes deeper, focusing on the health of your blood vessels themselves, building a long-term foundation for male vitality. Method 3, penis traction, to improve blood vessels and tissue elasticity. When people hear the phrase penile traction therapy, many assume it's only used for cosmetic enlargement. But in reality, this technique has been recognized by sexual rehabilitation specialists worldwide as a therapeutic tool for restoring erectile function, improving tissue health, and even correcting structural problems like curvature. How it works. The principle behind traction is simple yet powerful. A device is attached to the shaft of the penis and applies a gentle, continuous stretching force. Unlike sudden pulling or aggressive exercises, the traction is mild but constant, just enough to signal the body to adapt. Over time, This consistent stretch activates two key processes: tissue remodeling, mechanotransduction. Cells in the erectile chambers respond to mechanical tension by stimulating collagen and elastin production. This increases elasticity and flexibility of the erectile tissue. Angiogenesis. The stretching also encourages the formation of new blood vessels, improving overall penile blood supply. The result is not just a structural change in length or shape, but a functional improvement in how well the penis fills with and retains blood during arousal. Evidence from clinical studies. Multiple clinical trials have confirmed that 1-2 hours of daily traction for 3-6 months can lead to noticeable improvements in erection hardness, increased penile length, often 1-2 cm in flaccid stretch, but more importantly, better vascular function and erectile performance, especially in men recovering from prostate surgery or those with Peyronie's disease, curvature. For older men, traction also helps counteract age-related tissue stiffening, maintaining the sponginess of the erectile chambers and preventing microscarring that can limit blood flow. Best practices for safe and effective use. Proper fit is crucial. The device must be adjusted to fit comfortably. Too tight can cause pain or circulation issues. Start slow. Begin with 30-45 minutes per day and gradually work up to 1-2 hours. Increase traction gradually. Avoid rushing or using excessive force, which may cause bruising. Stay consistent. This is not a quick fix, but a long-term therapy. Think of it like physical therapy for your erectile tissue. Slow, steady progress pays off. Benefits beyond erections. Improved elasticity. Erections feel fuller and less rigidly strained. Better blood conduction. More efficient filling of the corpora cavernosa. Positive impact on shape. In men with slight curvature or deformities, traction often improves alignment over time. Confidence boost. Knowing that your erections are supported by real physical improvements, not just temporary solutions. So, if Kegel training strengthens the muscles and vacuum therapy boosts blood inflow, penile traction goes one step further. It rebuilds the tissue and vascular foundation itself. It's a commitment, yes, but one that offers profound rewards for men who are patient and disciplined. And remember, my friend, if you're still with me right now, it means you're serious about improving your health. Leave the number 3 in the comments so I know I'm not just talking to myself. Because in the next part, we'll go beyond physical methods. I'll share an internal support factor, something that helps your erection mechanism run more smoothly from the inside and keeps your performance stable over time. Part 2, boosting from within with a natural supplement formula. Alongside the training and therapy methods I've just mentioned, I often recommend that my patients combine them with an internal support solution to achieve optimal results. One option I highly value is Red Boost, a supplement designed to address the root cause of declining erectile function: oxidative stress around the smooth muscle of the penis. The smooth muscle plays a key role in keeping blood inside the erectile tissue. When the smooth muscle functions well, blood stays locked in for longer, helping to maintain stable firmness. Red Boost combines 5 natural ingredients: L-citrulline, tonkat ali, maca, eccrine, and nettle root. These compounds help boost nitric oxide production, improve blood circulation, and naturally support hormonal balance. With just a small daily serving, this product can become part of your sexual health care plan. When combined with the methods I shared earlier, you'll be building a solid foundation to maintain your performance over the long term. My friend, today, we've explored 3 science-based methods to enhance erection quality and male sexual health. Kegel exercises. Strengthen the pelvic floor, the foundation for controlling and maintaining an erection. Vacuum pumps. Stimulate blood flow into the erectile tissue for immediate results. Penile traction devices. Improve circulation, increase elasticity, and maintain long-term vascular health. By adding internal support solutions like Red Boost, you'll have a complete strategy working from the outside in and the inside out. The most important thing to remember is there is no magic method that delivers results overnight. Success comes from consistency, being proactive, and caring for your body every single day. Once you start and stick with it, positive changes will soon appear, not only in your intimate life, but also in your overall health and self-confidence. If you found today's information helpful, don't forget to subscribe to the channel and turn on the notification bell so you'll always be updated with the latest men's health tips. Wishing you health, vitality, and endless energy. I'm Dr. Marie, and I'll see you in the next video.